I am Dr. Sumit Talwar. I am the chairman of bariatric surgery of Manipal Health Enterprises Private Limited. The relationship of type 2 diabetes and obesity/bariatric surgery is a complex one. Type 2 diabetes, especially if it is uncontrolled, makes any surgery riskier. But a properly controlled type 2 diabetes will not have a major impact on the risks of bariatric surgery. In fact, after bariatric surgery, about 80% of type 2 diabetics will be able to go off all their medicines for a prolonged period of time.
I am super happy you decided to finally come and check this out. Below you have the actual download for the file, and it's a completely free file. Go ahead and read through it and really check it out, and really explore. Explore all the foods that are in the different sections. And as you go through this, try to be open. Be open about what you're gonna eat, and understand that everything that you've done now has gotten to you where you are right now. And if you want to make any drastic changes, well, you're gonna have to change the way that you eat as well. Food is a very powerful thing. Food controls everything. Food as medicine is far more important as medications as medicine. And everything that we put into our body can either do well for us or not do well for us. So go ahead and check this out, check the plan out, and make sure that you go through it multiple times so that you fully understand what it's all about. All right, thanks a lot.
26 million are diagnosed with diabetes. So you're looking at almost 20 million individuals with type 2 diabetes. So type 2 diabetes is a multi-organ disease. About 12 years ago, Dr. Ralph DeFranzo here in San Antonio, Texas, presented the ominous octet at the International Sessions of the American Diabetes Association in San Francisco. At that landmark presentation, Dr. DeFranzo presented the 8 different organs that contribute to the pathophysiology or the development of type 2 diabetes. The first thing that happens is your muscles are no longer able to hear the signal of insulin. Insulin goes to unlock the door, but the key doesn't fit. The hinges are rusty. The door can't quite open. And as a result, the door can't open, the sugar can't get in, and the body begins to have elevated sugars. Enough gets in so that it's able to burn off sugar, but the sugars begin to rise. As the sugars begin to rise, the body says, well, why is the sugar going up? I thought I told you to go tell the muscles. And he said, I did. He said, well, then go scream at them. And the pancreas begins to overproduce insulin to make more keys to open the door so sugar can go in. In the face of elevated insulin levels, you're able to keep the sugars under control as long as you're able to make insulin. But Dr. Ralph DeFranzo presented evidence that showed that even though you're making more insulin, what happens with type 2 diabetes is there's a genetic component of it, something that you inherit from your parents. And what happens is that insulin factories, these beta cells, they begin to die off. They become dysfunctional, don't make good keys, don't make enough keys, and they begin to die off. So as the insulin levels begin to fall, now you don't have enough keys to open the door, and the sugars continue to rise. As they rise, the body says, well, I thought we're supposed to keep the sugars down. Now we have to keep the sugars up. So then all these other organs start to kick into play to worsen diabetes. The liver, which normally stores sugar, now begins to produce sugar after a meal. The brain starts to drive up sugar by increasing its appetite and increasing hunger. The kidneys, instead of spilling sugar in the urine, begin to hold excessive amounts of sugar, abnormally high amounts of sugar. Other tissue in the pancreas that produces a hormone that causes you to make sugar while you're sleeping and not eating begins to overproduce glucagon, driving glucose production, gluconeogenesis in the liver. So you have the brain, the fat, the muscles, the kidney, the pancreas, the alpha cells, the beta cells, the gut. All these organs are dysfunctional, all driving hyperglycemia or elevated glucose. The patient hardly has a chance to support all these abnormal organs. And as a result, we have medications that work in every single one of these different organs as a mechanism to help reduce sugar, to help keep our patients under control.